Hi, my name is Claire. I'm the unit-based educator on the Mother-Baby unit here at University of New Mexico Hospital. And today we're going to talk about our childbirth education, mother-baby and newborn experience. We want to teach you about what to expect after you're transferred from labor and delivery to the mother-baby unit. On the mother-baby unit, we try to encourage rooming in, which means all routine newborn care is performed at mom's bedside. We do have visiting hours on the mother-baby unit. We are open from 5 a.m. until 9 a.m. and then again from 12 p.m. until 10 p.m. We encourage moms and their babies to rest and for the mom to learn how to take care of her baby during closed visiting hours. Children under the age of 14 are welcome to visit as long as they're not showing any signs of sickness. After the baby is born on labor and delivery, an identification band is placed on mom's wrist, baby's wrist and ankle, and then another identification band is placed on our support person's wrist. The other banded support person is allowed to come and go on the mother-baby unit regardless of visiting hours. Your body is continuously adapting throughout your pregnancy, labor, and delivery, and this process continues after you have your baby. So our job on the mother-baby unit is to ensure that this is happening without any complications. One of the things that your mother-baby unit nurse will be assessing is the location and firmness of your fundus. Your fundus is the top part of your uterus, and we expect it to be right in the center, nice and firm, about 1 or 2 finger breadths above or below your belly button. And as the days progress after you deliver, we also expect the location of your fundus to gradually decrease as your uterus shrinks to its pre-pregnancy size. Another thing that your postpartum nurse will be assessing is your lochia. This is a mixture of blood and mucus in your uterine lining. And initially, we expect your lochia to be bright red. The flow will be similar to that of a period. As the days progress after your delivery, we expect the amount of your lochia to decrease and the color to transition from bright red to darker red or brown, light yellow, and then eventually white. And this process could take 4 to 8 weeks on average. Your uterine muscles continue to contract after you've given birth to your baby. The purpose of this is to clamp down on the blood vessels that had previously been supplying your placenta with blood and nutrients for your baby. So you may feel what feels like cramping. This is totally normal. This is especially true if you are breastfeeding because an effective latch can release a hormone called oxytocin, which can cause uterine contractions. These afterbirth pains are expected to last a week or so. Perineal pain. The perineum is the area between your vagina and anus, and if you have a vaginal delivery, this area may experience some stretching or tearing, and after you deliver, you may have some pain and swelling. This is normal and temporary, and we encourage you to use your peri bottle, which we will give you to take home with you. It's a small plastic bottle that you fill with warm water and squirt from front to back each time you use the bathroom, and then you pat dry to help promote healing and comfort. We also have ice packs available as well, and some women find it soothing to use witch hazel pads, which we can provide as well. Many women are very nervous about having their first bowel movement after they deliver. There are some things you can do to help make this more comfortable. We encourage you to drink plenty of water, eat foods that are high in fiber, such as fruits and vegetables. We encourage walking, and we'll also be offering you a stool softener while you're in the hospital. You do not have to have a bowel movement before you can go home, so relax. So now we'll talk about babies. The newborn admission process is happening in mom's room at the bedside. Our newborn nursery nurses come to the mom's bedside with a radiant warmer and perform a very thorough head-to-toe physical assessment on baby, as well as checking vital signs to make sure that baby is healthy. Some newborn appearance variations. Newborns who are delivered vaginally may have some degree of head molding. This is a natural process which happens when the baby's skull bones aren't completely fused together. They're able to move and shift around so that baby's head can fit through the birth canal. The result is an elongated head, which is temporary, and baby's head usually rounds out within the next couple of days. Some newborns are born with quite a bit of vernix. This is a thick, white, greasy substance that covers baby's skin to help protect it while they're in the amniotic fluid. Much of the vernix is wiped off in the delivery room. However, some may linger in the armpits and creases, and this is normal and will likely disappear after the baby's first bath, but it still continues to serve as a skin protectant. Some babies are born with what we refer to as stork bites. These are reddened, flattened areas of blood vessels right under the skin, and they're often found on babies' eyelids, in between their eyebrows, and may be found on the nape of the neck. These will fade with time. Some babies are born with another skin variation called milia. These are tiny white dots usually found on baby's nose, and they're caused by immature sebaceous glands in the baby's skin, and these too will disappear on their own over time. The baby's umbilical cord is clamped at delivery, and we'll notice that it'll shrivel up over the next 24 hours. The umbilical cord stump will fall off on its own within 10 to 14 days, and no special cleaning is recommended. We do encourage parents to keep an eye out for any signs of infection. For example, redness or foul-smelling odor. You would want to call the pediatrician if you notice those things. Acrocyanosis is a bluish discoloration of baby's hands and feet, which is normal within the first 24 hours of life. Some babies also are born with Mongolian spots. These are dark areas of blue or purplish pigmentation, often found over the baby's buttocks, but can also be located on various parts of the body. These are more common in darker skinned babies, however, lighter skinned babies can be born with these as well. Newborn rash refers to reddening areas of the baby's skin, which is often found on the chest, back, arms, or legs, and you may notice tiny bumps as well. This can appear over a matter of minutes or hours and disappear just as quickly. It doesn't cause any distress to the baby. The newborn nursery nurse will also offer your baby 2 medications. The first one is erythromycin ointment. This is an antibiotic ointment that we place in the baby's lower eyelid to help prevent infection from bacteria that may have gotten in or around your baby's eyes during delivery. The second medication that is offered to newborns is a vitamin K injection. This medication is given in the baby's thigh muscle. Vitamin K is important in us forming our blood clotting factors, and newborns have very low levels of vitamin K initially. Giving them this dose of vitamin K at birth helps prevent life-threatening vitamin K deficiency bleeding. The nursery nurse will also get a set of footprints and place a security tag on your baby's ankle. The security tag will monitor the location of your baby while they are on the mother-baby unit. We do encourage parents to not remove the security tag. It will be removed before you are discharged. Once the nursery nurse is finished with the assessment and medication administration, they will offer to place your baby skin to skin. This means that you are holding your naked baby on your naked chest. Your baby will only be wearing their diaper. Skin to skin is very helpful in helping your infant to stay warm. It helps them regulate their heart rate, breathing, and blood sugar within normal ranges. They can hear your heartbeat and are comforted. Skin to skin can also help you bond with your baby. It can calm yourself and also helps you feel more confident in caring for your baby. It's also helpful in establishing breastfeeding, and dads are encouraged to do skin to skin as well. UNMH is a baby-friendly designated hospital. This means in addition to encouraging rooming in, we provide lots of breastfeeding education and support. We want you to make an informed decision on how you choose to feed your baby. If you choose to feed your baby formula, we will provide individual education on formula preparation and feeding. Breastfeeding is a natural process. It is also a learned skill for mom and baby. Once your baby is born, it will be very likely that your baby will be wide awake and ready to breastfeed. This may be the best opportunity that you get to have your baby latch on because they do experience a sleepy phase, which we'll talk about shortly. During this period of alertness, your labor and delivery nurse will be able to help you learn how to latch your baby to your breast. After this initial period of alertness, we often see babies experience a sleepy phase, which can last up to the first 24 hours of life. Some of the benefits of breastfeeding include decreased risks of postpartum hemorrhage for mom, heart disease, type 2 diabetes, high blood pressure, postpartum depression, and certain ovarian and breast cancers. For babies, it can decrease the risk of sudden infant death syndrome, certain respiratory and urinary tract infections, certain leukemias, childhood obesity, and type 1 and type 2 diabetes. We encourage your baby to feed on demand. This means your baby determines when they feed and how long they feed. We encourage moms and dads to watch their babies for feeding cues. These are signs of hunger, which can include smacking their lips, sticking their tongue out, and bringing their hands towards their mouth. Signs of fullness would include baby's body being relaxed, and they may even fall asleep at the breast. Pacifiers are not routinely given to breastfeeding babies on the mother-baby unit while we're establishing breastfeeding. Pacifiers may interfere with feeding on demand by masking feeding cues, and it could result in decreased milk production. Once breastfeeding has been well established, we do encourage parents to give babies pacifiers to help reduce the risk of sudden infant death syndrome, and this would be in about 3 to 4 weeks. There are several different positions in which you can breastfeed your baby. The cradle position is often the one that is envisioned when people imagine breastfeeding, but it might not be the best option to learn how to breastfeed with because babies don't have the greatest head control initially. One position that you might find comfortable is the football position. This is when the baby is held on their side and mom is holding baby with her arm underneath and supporting the head. This gives mom more control of the baby's head, and it's easier for her to see exactly what's going on. There's also the cross cradle position, which is similar to the cradle position. However, mom's arms are inverted. There's also side lying. This position may be helpful if you have a C-section. It's when you're lying completely flat on your side and the baby's lying completely flat on their side, and you and your baby are facing one another. This one may be easier to do once you are home and able to position yourself in your own bed. It is a good idea to try different breastfeeding positions to help pressure from being applied to the same area, causing soreness with each feeding. After the baby has experienced the first 24-hour sleepy phase, we oftentimes see babies experience what we refer to as a feeding frenzy. This is when they are awake and eager to eat, and mom may feel that she's not producing enough, but this is nature's way of telling her body that there is a demand. So baby may be wanting to eat around the clock. This is totally normal. At this point, we would like to see babies breastfeeding at least 8 or more times in 24 hours, telling your body that there is the demand because your milk supply follows the demand. Initially, your body is producing colostrum. Colostrum comes in small amounts, which is okay because baby's stomach is about the size of a cherry. Colostrum is much thicker than breast milk, and it may be clear or yellow. It's very beneficial in building your baby's immune system, and it has everything baby needs during the first few days of life. Mature breast milk comes in on an average of 3 to 5 days. When this happens, your breasts may feel firm and full, and breast milk will be much thinner than colostrum, and there'll be more volume. So how do you know if your baby is getting enough to eat? We look for signs of adequate breastfeeding, which would include the baby feeding 8 or more times in 24 hours, and we also look at the number of wet and dirty diapers that your baby is having. By day 5, your breast milk will be in, and we'd like to be seeing at least 6 to 8 wet diapers and 4 poops per day. You'll also notice that your baby's poop will transition from the initial meconium, which is very sticky and dark on day 1, to the seedy yellow baby poop by day 5. We offer lots of breastfeeding support on the mother-baby unit. All of our nurses are highly trained, and you'll be taken care of by them night or day. We also have lactation nurses who round on breastfeeding moms. They oftentimes will see moms after the first 24-hour period unless there are problems that develop before then. We also offer our newborn clinic, which has nurses who are IBCLC trained. This means they have received extensive training on breastfeeding, as well as our lactation clinic. Anyone can self-refer to the lactation clinic by calling and scheduling an appointment within the first 2 to 3 days after discharge. Now we're going to practice changing a baby's diaper. The diapers that we provide have a yellow stripe that will turn blue if it gets wet. I encourage parents to take the clean diaper with the tabs in the back, and you want to lift baby's legs both together and slide the clean diaper underneath before taking off the wet or dirty diaper, because the baby may continue to go and this will cause you to have a lot more laundry than necessary. So you want to unfasten the tabs and remove the wet diaper. If you have a baby girl, you're going to want to wipe from front to back. And then you take your clean diaper, and we encourage parents to kind of fold it underneath like that. We want to keep the belly button out of the diaper, and then you bring the tabs around to the center. It's very important to keep the umbilical cord stump out of the diaper so that it can stay as dry as possible and it'll heal without any complications. Once the umbilical cord stump has fallen off, then you won't need to worry about folding the diaper as much. If you're concerned if the diaper is too loose or too tight, if you can take 2 fingers and just kind of slide them in the front there, then you're good. And that's it. Some variations that parents see in their baby's diapers include uric acid crystals, which happen when the baby's urine in the diaper evaporates and leaves behind these crystals, which are pinkish brick dust colored. It can be very alarming for parents if they're unsure of what this is and whether or not it is normal, and it is temporary. Another variation is pseudomenses. This is found in baby girls. You may notice a white or pink vaginal mucousy discharge. This is her body withdrawing from mom's estrogen hormones, and it's temporary as well. Some parents may even see small amounts of blood in the baby's diaper. If you have any concerns about what you find in your baby's diaper, please notify your pediatrician. We want to keep your baby safe while in the hospital. On admission, you will be given a bulb syringe, which we encourage you to keep handy at all times, in case you need to help clear your baby's airway in the event that they spit up and have a choking episode. We encourage parents to wash the bulb syringe with warm soapy water and allow it to air dry after each use. And we will teach you how to use the bulb syringe when you're admitted to the mother-baby unit. You may walk in the halls on the mother-baby unit, but your baby must stay in their crib. Also, you don't want to leave your baby unattended in your hospital room. We will also teach you about safe sleep for newborns. The safest position for your baby to sleep will be flat on their back on a firm surface with no fluffy blankets, pillows, or bumper pads or anything soft that they can roll into. We will give your baby a hat that we encourage you to keep on them during the first 24 hours of life so they can maintain their temperature. Afterwards, the hat should be removed when the baby is put down to sleep. In the event that they will pull the hat down, it can become a suffocation hazard. We want you to continue safe sleep at home. It is recommended that your baby sleep in your room on a separate surface that's designed for infants for at least the first 6 months, ideally for the first year of life. Tummy time is an important part of infant development. This is when your baby is fully awake and fully supervised, and you can begin with 3 to 5 minutes at a time. Tummy time helps with neck and shoulder muscle development as well as hand-eye coordination, and studies have also shown that it can contribute to learning how to crawl and eventually read. Next, we're going to cover a couple of different swaddling techniques. So the first technique is known as the diamond method. So the baby blanket is a square, and we turn it like a diamond and fold the top corner down. Then we place the baby's shoulders on the fold. It's very important that the baby isn't placed too far down, because when we do swaddle, we don't want that to happen. So we've got our shoulders at the fold. So the trick to a successful swaddle is using the baby's body weight to keep the blanket in place. So we take one corner here and bring it around the baby's body and tuck it under their butt like that. Some babies like to have their arms swaddled in, some prefer to have them out. It's really their preference. Next, you take the bottom corner and bring it up around their shoulder. And Then you take the last corner here, bring it all the way around everything, lift up their butt, and there you go. So that is the diamond swaddle. The second swaddle method is also known as the square method. So you take the swaddle blanket and have the top edge flat, and then take baby's shoulders and place them at the level of the blanket. Next, you take one corner and bring it around like so. Then you take the second corner. And to secure the swaddle, you're going to bring the bottom all the way up and roll the baby to one side, using their body weight to keep the blanket in place, and do the same on the other side. And that's how you do the square swaddle. We do offer to give your baby a bath in your hospital room. Before we can do this, we need to ensure that your baby is able to maintain their temperature. And after the bath, baby is held skin to skin for a minimum of 30 minutes, and dads can do skin to skin as well. Here are some of the supplies we provide for baby. Diapers, wipes that are dry, we run these under warm water, t-shirts, swaddling blankets, hats, and baby shampoo. If you'd like to bring your own diapers or wipes, you're welcome to. Just let your nurse know. We also offer the hepatitis B vaccine. This is the first in a 3-part series. If you'd like your baby to receive the hepatitis B vaccine, we will have you fill out a consent form. You can also opt to have it given at your pediatrician's office. Once your baby turns 24 hours old, we perform several tasks. The first is a weight check. Some weight loss can be expected as there is a fluid shift from being in utero to being out in the world. By day 4, we expect babies to begin to regain weight, and by 2 weeks, they are typically back to their birth weight. Another task that is performed once your baby turns 24 hours old is the critical congenital heart disease screen. This is performed by placing a pulse oximeter probe on your baby's wrist and another on their foot. The oxygen saturation is measured to determine if the readings are within normal limits. We will also be checking your baby's bilirubin level. Bilirubin is a waste product from our bodies filtering our blood, and often newborns aren't very efficient at getting rid of excess bilirubin. A buildup of excess bilirubin in the blood can cause jaundice, which is a yellowing of the skin. It can cause other serious problems if it's left too high and untreated. Getting rid of excess bilirubin happens through frequent feedings, pooping it out, and phototherapy if medically indicated. We also will be collecting a metabolic screen. This is a blood test collected by placing drops of blood from your baby's heel onto a piece of filter paper that is sent to the state health department. This is tested for many different genetic and metabolic disorders that a baby may not be showing symptoms of right away. You will be bringing your second metabolic screen to your 10 to 14 day follow-up pediatrician appointment. If you have a baby boy and wish to have him circumcised, the pediatrician will come to your room and talk about the risks and benefits as well as the details of the procedure. Circumcisions are performed in the procedure room of the newborn nursery, and oftentimes parents can accompany their infant there. Once the circumcision has been completed, we'll be assessing the circumcision site for bleeding. We'll also be teaching you how to apply Vaseline gauze dressings to the circumcision site. Healing typically occurs in 5 to 7 days, and we encourage parents to give sponge baths until the circumcision has completely healed before submerging the baby in a baby tub. There may be a yellow film over the end of the penis, which is a soft scab. This is normal. Do not remove this. Our birth registrar will come to your room and collect paperwork to send to Vital Records to establish your baby's birth certificate and social security card process. These documents will be mailed to you within 6 to 12 weeks. The birth registrar can also provide a proof of birth document right away if you need it before you're discharged, or you can turn in paperwork to their office and receive this within the mail within 1 to 2 weeks. The birth registrar can also help you with the acknowledgement of paternity paperwork, as they are notaries. Dad will have to have his driver's license for this. Your baby needs to be in their car seat when you drive them home from the hospital. It's a great idea to visit a car seat fit testing clinic prior to your baby's birth. You can call this 1-800 number to make an appointment, or you can visit safernewmexico.org to find out when the next car seat fit testing clinic will be held. Here are some tips on how to soothe a fussy baby. A crying baby needs something, whether it's a diaper change, they may be hungry, they may need to be burped, or they just may need attention. One thing you can check right away is their diaper. If they're wet or dirty, a dry diaper may be all they need. Swaddling mimics the feeling of containment they feel in utero. Shushing a baby may mimic the sound of your circulatory system that they hear while they're in your belly. Rocking or holding your baby while walking mimics the movement they feel while in utero as well. Talking or singing to your baby can also comfort them, as they do recognize familiar voices that they've heard. If none of these things work, talk to your pediatrician for more ideas. Keeping your baby healthy. Remember to wash your hands before you feed your baby and after every diaper change. Also, visitors should wash their hands before they touch your baby. If anyone has a runny nose, cough, or fever, keep them away from your baby. It's also recommended that anyone who's going to be taking care of your baby receive their Tdap and flu vaccines. Also, if you can avoid bringing your baby unnecessarily into public places for the first 3 months, this may be beneficial, as they are still building their immune system. It's important for mom to take care of herself so that she can take care of her baby. You may have certain activity restrictions, such as restricting heavy lifting. Listen to your body for your limitations. It's also encouraged that you rest as much as possible. Try to sleep whenever your baby sleeps. If you have a C-section delivery, you will likely have steri strips covering your incision. These are tape-like strips that do not keep your incision together, but they do help support your skin. You can shower with these and they will fall off on their own within a week. You do want to clean your incision with warm soapy water and make sure that it stays dry. We encourage moms to look at their incision in the mirror to keep an eye out for any signs of infection, such as redness, draining, or separation of the skin. Your pelvic floor muscles support your bladder and uterus. These can become weakened after carrying a baby, and this weakening can cause urine leakage. We encourage moms to practice Kegel exercises to strengthen these muscles. If you can squeeze and hold your pelvic floor muscles for 10 seconds and then release, or do quick flicks of rapid squeeze and release, doing 6 sets of 10 of these per day will help prevent urine leakage, and it's also encouraged to continue these throughout your lifetime. Baby blues can occur in 3 out of 4 women, and it's a normal part of having a baby. This often occurs during the first week or so after delivery, and it can involve mood swings. You may be very happy one minute and then crying the next, and this is totally normal and temporary. You want to take time to take care of yourself, talk with other friends and other new moms. Postpartum depression is different from the baby blues and is more serious. It can occur in 1 out of every 10 women. You may feel like you can't take care of yourself or your baby. You may have feelings of being overwhelmed, and these can last every day for 2 weeks. This can happen to anyone. If you're concerned that you may be experiencing postpartum depression, please contact your provider so they can connect you with resources. The ROSE program is offered at the Women's Primary Care Clinic on Eubank. These are prenatal classes designed to help prevent postpartum depression by teaching women how to reduce stress, recognize the importance of supportive relationships, and manage unsupportive ones, practice relaxation techniques, set goals, and many other resiliency boosting strategies. These classes are 1.5 hours long, and there are 4 in the series. Talk to your provider about more information about signing up. The Eubank Clinic is also the home of the Journeys Clinic. This is a mental health clinic for pregnant and postpartum women with mental health disorders such as anxiety or depression that are pre-existing or may be newly diagnosed. If you are interested in finding out more about the Journeys Clinic, please speak to your provider so they can make a referral for you. Our Triage Logic Nurse Advice Line is available 24/7. Our UNMH OB Triage is also available as an emergency room for women up to 6 weeks after they deliver. No appointment is needed to visit OB Triage, and it's open 24 hours a day, located on the 4th floor of the BBRP. The minimum requirement for your baby in the hospital is 24 hours after birth. If you have a vaginal delivery, you may stay up to 48 hours. If you have a C-section, you may stay up to 96 hours. When you go home ultimately depends on when your provider and your baby's provider determine it is safe for you to go home. We hope you've learned a lot about how to take care of yourself and your new bundle of joy. Remember, we're here to help you each step of the way. Thank you for watching.